The objective of this module, the financial aspect of aging, is to introduce the learner to the financial aspects involved in aging in the United States. Students will be introduced to health insurance plans that all Americans receive when they turn 65 and what that plan covers when one is hospitalized or requires skilled nursing services. This module will also discuss ways in which one can prepare their finances and make wise decisions to plan for a successful retirement. As I said before, our older population, or our older adults, are the fastest growing age group in the United States. The proportion of population over 65 is outpacing those under 65. The younger people are not having as many children, and the older people and the baby boomers are aging out. By 2060, almost 25% of the U.S. population will be age 65 or older. Healthy 2030, a government agency, is focusing on reducing health problems and improving quality of life for older adults, as we know many of them wish to remain in the community. Older adults are at higher risk for chronic health problems such as diabetes, osteoporosis, and Alzheimer's disease. In addition, 1 in 3 older adults will fall each year, and falls are the leading cause of injury for this age group. Knowing that physical activity can help older adults prevent both chronic disease and falls-related injury, it's imperative that older adults remain as physically fit as they can as they age, in order to prevent some of these geriatric syndromes that we see in older adults. Not long ago, older Americans typically were poor. Once people stopped working, their fixed income from Social Security or a pension was rarely adequate to support them comfortably. Today, a greater number of older Americans have funds and investments that provide them with some financial security. Nevertheless, many Americans 65 or older have incomes below the poverty line, despite the fact that for a person 65 or over living alone, the threshold for being classified by the government as living in poverty is stricter than it is for younger people. Some older people have limited resources but have assets, particularly homes, that prevent them from meeting the strict definition of poverty. Fluctuations in interest rates tend to hit older people hardest because their reliance on what is often called investment income. High inflation rates hit older people hard as well because their incomes do not usually adjust upward as prices increase. Even with homes and investments, many older Americans may not have incomes that are sufficient to meet all of their needs. They may be unwilling or unable to sell their home, or they may be faced with increased expenses such as for prescription drugs or in-home assistance. The complicated issues involved in real estate and other investments and the need to plan for longer retirement periods have made careful financial planning an essential preparation part of growing old. The aging of the population has put a burden on the country's ability to pay for the services needed for older people. As you know, the proportion of people 65 or older is increasing and estimated to double in the next few years. Many provided services involve medical care, but many others, including Social Security, do not. As the proportion of older to younger people increases, less financial and social support will be available for older people. This imbalance occurs because after retirement, people pay less taxes due to decreased earnings, while the proportion of workers available to pay more into the system decreases. The question of what's new today in requirement is far more than just about headcount. Behind all the numbers of exploding seniors that are occurring in this country, Americans over the age of 50 turn out to be the most powerful and affluent consumer group in history. Americans over 50 control 76% of the total net worth of U.S. households. They have a combined annual personal income of over $5.7 trillion and nearly $80 trillion of wealth. The mature households now account for $7.6 trillion in direct consumer spending, or 56% of the total. For categories including the healthcare, they account for 2/3 of spending. They are responsible for purchasing or consuming 82% of home healthcare services. 78% of older older Americans own vacation homes. 75% contribute to charities. 75% consume prescription drugs. 75% of older adults use landscaping services. 74% use accounting fees. 71% of older adults buy all the over-the-counter medications. 70% of older adults utilize dental services. 50% of older adults utilize health club memberships. So looking at assets and spending power generationally, boomers are the wealthiest cohort ever. They have the median household net worth of $206,700 and an average of $1,210,100 total worth. They control 54% of our wealth, and they make up more than 56% of the 12 million households over $1 million in assets. However, there is a wide difference between median and average net worth, which really reveals the uneven distribution of wealth among the boomers. Half are worth about $200,000 or less. That's a lot of people. This leaves many financially unprepared for retirement. While some have significant wealth, there are many that do not. So comes the retirement landscape. Looking at the landscape today, it has changed drastically in years past. Many people today attempt to do what's called a phased retirement. In other words, they don't want to leave their job all at once. They want to phase out slowly. They may begin to suddenly work 4 days a week, take an extra day on the weekend. They may then go down to 3 days a week. They may decide to go to the office 2 days a week. That's what we call a phased retirement. They're not quite ready to say, I'm going to shut things down and rely solely on my pension, my assets, and my Social Security. We also have a lot of people today that are retiree returns. They retire, they haven't made plans to retire, and they find themselves with nothing to do. Well, they can't think of anything to do because they've always had a strategic plan of getting up every day and going to work. We find these retirees often go back to work. They're called the retirees who return. We know that it's very important for retirees today to have networks. If you have a network when you retire, a network, a social network, a network of friends, a network of professionals that you can be in touch with, people are more likely to possibly stay retired and reinvent themselves. We do also have a lot of people that do career reinvention. For instance, people retire and they decide they were experts in their field. They may decide to mentor young people. They may decide to open their own consulting firm and consult young individuals on the ins and outs of whatever particular job title that they had. So all of these things have changed retirement today. What's really important is to remember that 7 in 10 retirees expect to work past the age of 65, and many are already doing so. Retirees work because they need the money, number one. Number two, because they want to stay mentally, physically, and socially active, or simply because they love what they're doing. Many choose to work in new occupations, to start new businesses, or to launch encore careers that give back to society. Retirees also have the greatest influence on how to enjoy our time. In their everyday leisure pursuits, they seek to stay active and healthy. On special occasions, they seek memorable experiences, sometimes taking the trip of a lifetime. What goes along with all of this is health. Health is the key ingredient to an active and healthy retirement. The additional life expectancy at age 65 is over 20 years for women and about 18 years for men, give or take some adjustments that have gone along with the pandemic that we just experienced. The average person can expect to be in good health for about half of that span and is probably already managing some chronic diseases like hypertension. They don't call it the silent killer for nothing. Loss of health is a retiree's greatest source of worry, and Alzheimer's has become the most feared condition of age. The need for care naturally increases with age. It's almost unimaginable what retirees will consider doing and spending to retain their health for as long as possible. Most people 65 or older continue to live in the community, and even among people 85 and older, more than 78% of women and 88% of men continue to do so. By age 65, about 1/3 of women live alone. By age 75, more than half do. Because women tend to live longer than men, fewer older men live alone. Some older people remain in their homes because of help from relatives or outside services. Most people over the age of 65 continue to live in the community, and even among 85 or older, more than 78% of women and 88% of men continue to do so. By age 65, 1/3 of women live alone. By age 75, more than half do. Because women tend to live longer than men, fewer older men live alone. In the past, older Americans typically moved in with younger relatives if they became impaired. Nursing homes served few older people, mostly those who had no family to care for them. However, this situation has changed drastically. Older people who are no longer able to live alone can now choose to live among several levels of care, including retirement facilities, assisted living communities, and nursing homes. Currently, there's close to 2 million people that reside in American nursing homes, and 15% of nursing home residents are in a nursing home for a relatively short period of time while they recover from an illness. The remainder will spend the rest of their lives in a nursing home. Older people tend to have more diseases and disability than younger people, and most of the diseases are chronic, and older people sometimes have many diseases at the same time. So in the United States, 70% of all deaths occur after the age of 65. In the majority of these deaths, the top three are heart disease, cancer, and stroke. Knowing that disease and disability can greatly limit independence and increase the need for support, how well a person functions is determined by their ability to perform self-care activities. We call this activities of daily living. Okay, who's eligible for Medicare? Well, who's eligible? Every American who reaches the age of 65 is eligible for Medicare. You first become eligible for Medicare approximately 3 months before you turn 65. For younger people who have a disability such as end-stage renal disease or any type of neurological disorder such as ALS, you can potentially get Medicare younger than 65. There are 4 parts to Medicare. Part A, which would cover your inpatient hospitalization. Part B, which is your outpatient medical coverage, your doctor's appointments, things like that. Part C is an alternative way to receive your Medicare. I'm not going to really discuss Part C too much. in this module, but Part D is your prescription coverage. So even though you automatically get Medicare when you turn 65, there's something called the donut hole, okay? And the donut hole is where Medicare will provide health care coverage for people 65 or older. But if you're enrolled in Medicare Part D, which is the prescription drug plan, it's possible that you could encounter a gap in your coverage depending on how much you spend for your prescriptions. So this gap we've called for years the Medicare donut hole. And it happens to actually a lot of middle income people that have worked their entire lives and saved and end up having difficulty paying for their healthcare prescriptions. It doesn't take much to fall into the donut hole. So for 2022, for example, the coverage gap begins once you have spent $4,430 on covered drugs. I can tell you, if you have simple hypertension and you're on possibly 2 or 3 medications and have high cholesterol and you're on another medication for that, so that brings it up to 4, you have a little type 2 diabetes, you could easily fall into the donut hole or the gap in coverage and end up paying out of pocket for what's not covered by Medicare. So, if you and your drug plan reach the spending threshold and enter into the donut hole coverage gap, you'll pay no more than 25% for the cost of any covered brand name prescriptions, but the rate applies whenever you purchase the prescriptions at a pharmacy or through a mail order service. The discount is applied to the price your plan has set with the pharmacy. So it can be quite daunting for some people. For instance, Medicare will pay 75% for the cost of a generic drug while you're in the donut hole. But if you're allergic to some of the ingredients in the generic drug and you need the brand name medically necessary, they won't always cover that brand name medication. So it can be a problem for some people. So it's good insurance if you're healthy. So the moral of the story, ladies and gentlemen, is to stay as healthy as possible as we age. So these rules that I talked about in Medicare apply to everyone, right? Everyone who's a candidate for Medicare is eligible to fall into this donut hole. And the majority of people that fall into the donut hole are the middle class, as I said, or the working class. I don't know if there's any such thing as a middle class anymore. But I do tell seniors that are signing up for Medicare, if they do have a supplemental insurance, in other words, if you worked for a company and you've had medical coverage through that company, some people, when they retire, have medical for life in addition to their Medicare. So that supplemental insurance, actually will pick up what Medicare Part D doesn't cover. So it's important sometimes to have a secondary insurance for many people. Even as an insurance policy, you can be very healthy and doing the right thing, and something can pop up, some type of geriatric syndrome, as we discussed in the other module, and require you to need medications. So if you have that supplemental insurance, many people buy I can't think of the name offhand, a plan such as Optimum or Blue Cross Blue Shield, they'll have as a supplement. It's now called Medicare Advantage. Okay, so Medicare Part D obviously is the voluntary outpatient prescription drug program for everyone on Medicare. And it's provided through private plans that contact the federal government. So beneficiaries can choose to enroll in either a standalone prescription plan or supplement traditional Medicare now, which is called Medicare Advantage. Some people are leery because Medicare Advantage is basically an HMO or a PPO. And what people fear is not being able to see their preferred provider. In other words, if I see Dr. Jones, my healthcare, and he's not in the HMO that I sign up for, will I still be able to see my doctor? So this becomes an issue for older adults, and it can be quite daunting. I tell everybody to go online, watch YouTube videos, sit down with with the plan, the HMO plan that wants to sign you up, and think about it. Write the pros and the cons down to see if it's worth it for you to sign up for these plans. Is it all about the finances? Well, actually, retirement has changed enormously in the past few decades in its duration, the circumstances giving rise to it, and the decisions an individual has to make. Most people will tell you that they're unprepared for the profound personal and life changes that retirement brings. So addressing the non-financial issues seem to hold the key to satisfying and fulfilling retirement. But more importantly, financial matters do need to get the necessary attention. What we find is that some people were forced to retire. There's been downturns in the economy, and you'll have an individual that was downsized from a company that they were possibly with for many, many years, and they're automatically forced to retire, sometimes a little bit younger than they planned on retiring. So it's important to see a financial advisor. Make sure that you have a plan, and you should do it sooner than later. In other words, you should really begin planning for retirement as soon as you begin working. Social Security is not guaranteed to be there for the younger generation. So many people have 401ks and pension plans, but many pension plans are going by the wayside these days. So it's important to speak to a financial advisor and to plan out exactly where financially you want to be in 5 years, in 10 years, in 15 years, if you're just beginning work, so that it doesn't come up on you suddenly and frighten you or cause you to drastically alter your lifestyle. As people get older, they also have to think, when they're planning retirement, they have to speak to their significant other and say, what do we both want to do? Do we want to travel? Do we want to live in the same state? Can we afford to live in the same state with the taxes you're potentially paying? Do we want to be near our children? Do we want to be close to our grandchildren? These are all issues that need to be resolved before somebody makes that decision to retire. I just said this in the last slide, but where and when will you and your partner choose to live? You can go on Forbes magazine, and they'll give you the 10 best places to retire, or the top 20 great states to live in when you're retired. But again, the questions of will you be close to your family are important. Some people that live in the Northeast or in cooler climates and develop conditions as they age, such as arthritis, may choose to live in a warmer climate. It's easier to stay physically fit when you live in a nice, sunny, warm climate than if you're covered in snow for 4 to 5 months out of the year. Who you choose to have in your life is very important. The rhythm of your life will change. Your routine is not going to be what it is when you get up and go to work every day, and it will not be dictated by who you work for. So basically, your very identity will change. You will no longer be the vice president of whatever company or the faculty professor at whatever CUNY you work at. Your role, your position, and your status in many relationships will be redefined. So difficult conversations have to be had. The good news. Many people are happy to retire, and many people today are retiring on their own terms. In other words, they're not necessarily going out for good. They're sometimes cutting down their work schedule to work 2 to 3 days a week, which is really wonderful, to be able to slowly um, work their way into retirement. The pandemic did a number on a lot of people. They were home. They got used to being home, and many of them made that decision. You know what? I think I will retire. It's time. So it's important, for people to talk about it. It's important to stay socially connected to others, which we know is essential for good health and well-being, especially mental health. The isolation did a lot of damage to older adults. They were in their homes. They didn't see their loved ones. They didn't see their grandchildren. It really caused a lot of breakdowns in family structures. People that often saw their grandchildren possibly a few times a month were not seeing them because their grandchildren were told they can pass the COVID on to their grandparents. So there was a lot of people failed during that pandemic. A lot of older people failed, and they really struggled with loneliness. So that's really that's one important thing we know, is that we're social beings. We need to be around people. We need to interact with people. So just because one retires and they have less structure, it's great when independently you can create your own structure. You'll have time to set your goals. You'll have control basically over your time. You can pursue great adventures. You can have quality time with your spouse, your family, and your friends. When thinking about retirement, it's important to think about what you want to do. What is your purpose going to be? How are you going to invest your time? Today, people have worked very hard to reach retirement age, so many people want to remain busy, but busy with what they really want to do for themselves. Not busy because I have to be at work at 9 o'clock and stay there until 5 o'clock. So you need to sit down and think about what you're interested in. Possibly joining a continuing education program. Some people decide they want to teach in a continuing education program. They want to impart the knowledge that they've gained through their profession and career. Other people want to consult. Some people just want to take continuing ed classes in another area altogether just to keep them busy. Some people want to contribute their skills to the community, either as a volunteer or a coach. Deciding at what level you want to contribute to your community is something you have to think about. How much time can one imagine spending on the arts? How many times does somebody say, I'd love to go to this museum, or I'd love to travel and see that museum? This is the time where you can put your goals down and make it happen. Choosing where to live. Choosing where to live is important. Okay? Too often people postpone giving any thought to where they'd like to live when retirement options opens the choices. Number one, you have to look at your financial resources. I can't decide I want to live in Beverly Hills if I can't afford to live in Beverly Hills. So it's important to research that. Research the best states for retired individuals. Where do you get the most for your money? You need to reassess family ties. It's important to see your children and your grandchildren, even if it's part of the year. Are there health issues involved? Do I want to live in a community, a retirement community, or some type of assisted living facility where I'll have socialization, yet when the time comes and I require help, I'll have help when needed? Again, some people feel warm weather is best. We know that exercising outside is good for the joints. Many people do go to places in the Southwest and the Southeast, like Florida, to retire. Housing, that's an issue, right? We know that many people made a lot of moves during the pandemic. Number one, they were working from home. They were working from home on their computers. They could work from anywhere. So people that had winter homes and summer homes and second homes, many of them moved to those homes to be by themselves and to enjoy themselves while they were working from home. So really thinking about where you want to live and your housing needs are very important. The demands of maintaining a house suitable for a larger family when your children are grown and have moved out should really be a discussion that couples need to make. Then again, downsizing has two elements. You have to empty your house and all of its contents. So you have to sell your home. Is it the right market to sell your home? How do I get rid of everything I've acquired for the last 30 or 40 years that I've been living in this home? These are all questions that somebody has to think about. Even deciding to move to a home where you can live on one floor. As people get older and they start to have problems with arthritis and other types of issues, it's much easier sometimes to be all on one level. So these are some of the things that people really should think about before they make the leap to retire. It makes their life so much easier when they have some decisions made. Well, the simple truth is good health is a prerequisite for your happiness and a keystone for the rest of your life. Even if you've not ever had a significant health concern, it's important to make sure you make your annual appointments. It's covered by Medicare. Set an exercise plan. Find exercise that you enjoy and keep to it. If you don't take care of yourself, you can't take care of anybody else. That's a very important thing to remember. So being physically fit and choosing the right exercise. You don't have to decide to be a daredevil when you retire. It can be golfing. It can be yoga. It can be something simple. It doesn't have to be competitive sports, but it has to be something to raise your heart rate a few times a week and keep yourself limber and flexible. Because we know that having time during retirement can give you that incentive to stick to that regime or that schedule that you may set up. And it will improve your quality of life. Playing golf, tennis, hiking, biking, walking, water sports. These are all things that some people start to reimagine as they age. But not only will exercise lengthen your life, it will quickly make many people feel better and improve your overall quality. So, have that discussion with a personal trainer, make an appointment, find something you can do, make a plan, pick an exercise, and start doing it. Finally, getting your finances together and planning for retirement. As I said, it's important to do earlier than later. But deciding whether or not to create a living will versus a trust is important to do before it becomes emergent. Many people have wills when they're younger and they're raising their family. If God forbid something happens to them, who's going to take care of their children and raise their children? But then many times people don't change them. And as we get older, we need to have these conversations with our children and our significant others, and decide, who do we want to speak for us if we're unable to speak for ourselves? How do I want the end of my life to be? Do I want quantity over quality? Because sometimes quantity over quality is not a peaceful life, right? So things need to be said and things need to be written down, and plans need to be made for the future, because sometimes we know as we age and our brain ages, and sometimes things come up suddenly as we age. And if something comes up suddenly and you don't have a power of attorney or a healthcare proxy to speak for you, situations can become dicey if you're in the hospital or if something happens. Financial, we know that many people don't like to talk about their finances with anyone, but you should have something set up to, if something were to happen to you and you were unable to pay your bills suddenly, that somebody you appoint, somebody close to you, a child, son, a daughter, is able to go in and pay your bills for you and access the help they need to access. So these are things that need to be discussed and need to be talked about and need to be written about, to really save you a lot of aggravation in the event of an emergency. And finally, knowing the signs of dementia, they do seem to sneak up on people, because sometimes as people age, when they start to decline mentally, oftentimes if somebody stays in their own environment, it's not noticed. In other words, if your mom and dad get up every day and they have their little routine where maybe they go to church and they go to the senior center and they go to the store and they come home, you may not notice differences in or declines in their health. But if you visit, you may notice that all of a sudden, mom and dad are writing a lot of checks to, a certain fund that they think they owe money to, or they're making unusual purchases. You may go in and find that there's piles of unopened mail. They've forgotten to open their mail and pay their bills. If they start to complain about money, that they don't have any money, or they think people are taking things from them, sometimes that can be a sign of the start of dementia. So try to, as I said, have these conversations early. Mom, Dad, what would you like to do if and when the time comes where you can't care for yourself? Would you like to stay in your home? Because most people choose to stay in their home. And if you can stay in your home, things have to be in a trust, right? There's trust that attorneys can put together. It's not that expensive, to make sure that all of their money goes to taking care of them, and all of their money that they've earned and saved and invested doesn't go to the government when at the end of their life. So it's important not to be afraid to have these conversations, because honestly, I've seen people fall, break their hip, go to the hospital. All of a sudden, they're confused in the hospital. All of a sudden, they get an infection, and now they're in an extended care facility, and they may never go home again, right? And I wish I could tell you this isn't the case, but this is the case in many instances. So these conversations and knowing what the signs of dementia are very important, in order to really try to stem the tide and get in there before you have to go in and take things over. Hopefully go in and have them voluntarily allow you to assist. Coming near the end, we're discussing what families can do to help older adults with their finances. Many conversations about what to do or what one wants if and when the time comes when they're not able to care for themselves are difficult to have, but so very necessary to start early. By starting that conversation early with your loved ones, you can assure them that when the time comes, you'll be able to assist them in whatever needs they may have. So your mom or dad may be totally fine with handling their own affairs, but you should always talk about what they want, what and if and when the time comes that they can't handle their own affairs. In 1991, healthcare proxies were passed into law, and at that time, it revolutionized healthcare because individuals were able to decide who can speak for them when the time comes that they can't speak for themselves. So almost all of us, regardless of age, should have a healthcare proxy. Older adults, additionally, should have a living will, and hopefully somebody they can trust to come in and to help them live their last years or days out the way they would have wanted to. So when the time comes when you notice mom and dad are maybe forgetting to pay a bill or forgetting certain things that you might think of significance, obviously the best thing to do is to make sure they have a comprehensive geriatric assessment done by, a good interdisciplinary team, which is typically a geriatrician, a nurse, a social worker, and a pharmacist. By having this all together, they'll be able to assess your loved one's functional ability, which is their ability to do their activities of daily living, such as eating, dressing, bathing, transferring between the bed and the chair, using the toilet, controlling their bowel and bladder. If individuals are able to independently perform their activities of daily living or their ADLs, it really enables people to live independently, to include preparing meals and doing housework, taking their medications, and managing their finances. Once a physical and health assessment is done, which should be done yearly, problems with vision or hearing, continence, or gait imbalance can be addressed. If there's a partial caregiver that needs to be involved, this is the time when maybe the person might be entitled to a certain amount of hours per day. Cognitive and mental health is really probably, as I said, the biggest fear as people age. People want to stay mentally healthy, obviously, their entire lives. But we do see mental health problems detected in older patients, especially depression. Oftentimes they experience insomnia or changes in sleep patterns. We know that they experience constipation, right? Oftentimes because of the medications they take for blood pressure, which cause them to be drier. Some of these medications that they take for their health, for their chronic conditions, could actually contribute to cognitive dysfunction as it slows down all the processes. So it's important if we start to see a preoccupation with bodily functions or increased alcohol consumption or withdrawing from family, sadness, hopelessness, crying. These things are all signs that your loved one is experiencing some type of mental health alteration. It could also be that they are falling into or developing Alzheimer's, right? Which is a huge fear. So before that comes, because oftentimes families will say, well, Dad was just paying his bills and driving the other day. I don't know what happened. It usually doesn't happen overnight. It's usually gradual. So what loved ones need to know is they need to make changes gradually. Instead of going in and saying, Dad, you can't drive anymore, or Dad, you can't pay your bills anymore. How about, Dad, can I sit and help you pay your bills? Can I help you balance your checkbook? Show me how you do it in case you need me to help. Being able to take an inventory of their financial and legal documents will help you if your loved one falls down and breaks a hip and is hospitalized and you have to go in and pay their bills, right? And try to get them to simplify their bills. And if possible, even at some stage, take over their financial tasks. It's a good idea sometimes if you have a trusted relationship with your older family, older adults, older parents, to even consider having them make you a power of attorney if and when the time comes where things need to be decided for them. And as I said, this usually comes from a position of trust. We just don't make anyone our power of attorney, but it can be very scary if all of a sudden you find that your loved one has full-blown dementia, and you don't know where any of their finances are, any of their legal documents are, you all of a sudden have a big monumental task. So it's important to, as your parents age, have these conversations, start them early, continue them, don't be pushy, but try to help them make sure they have everything in order. It'll make things easier for you as a family member when the time comes that you may need to provide more help than you have had to do in the past. And remember, always communicate with your loved one and document what you're doing, and make sure you keep your finances separate, especially if you come from a large family and the mother or the father chooses one sibling to be the power of attorney. It's always a good thing to, get an Excel sheet, write everything down, explain what you're doing and why you're doing it. It's helpful for family dynamics if this can be done so that everyone understands why you're paying your parents' bills, or why you're assisting with their finances, or why you're helping clean out their house, whatever the reason might be. And finally, we have a saying in nursing, quantity versus quality, or quality versus quantity. I'm an old oncology nurse, and we were always asked where I worked, how do you want your last days to be? If you found out today that you were dying, would you say to the doctor, I want every single thing done to live a good long life? Well, obviously, if you're young and you have a family, you want to live a good long time. But then again, ask somebody who's 90, how do you want your last days to be? And most people who are older will say, I want to be surrounded by the people that love me. I hope to be pain-free. I want to be able to maintain my dignity. I want to be able to do for myself if I can. I would hope to be alert and oriented and have mental clarity. I would hope to remain in my own home. Yet, nobody really wants to die, right? They want a good death, but they don't want to die. I want to receive whatever medical intervention is possible to help me live. But at the end of the day, I want my quality of life to also be good. So if we can remember that going forward with our loved ones and with our clients down the road, it really helps to allow someone to have a good legacy when they look back on their life. I'll finish with one final story. There is such a thing as a good death. I experienced it while taking care of my dad, who became sick very suddenly at the age of 84, and he was diagnosed with cancer. But the week before he was diagnosed with cancer, he was playing golf and going out to dinner with friends, and everything was fine. But he was diagnosed with cancer, and it was bad. It was metastatic throughout his entire body. And I was his power of attorney and his medical proxy, and the doctor gave us choices. He can have chemo and possibly live 9 to 18 months, or he could do nothing and we can manage his pain and he can stay at home surrounded by loved ones. Well, we were so blessed to keep him home. He passed away in 8 weeks' time, as comfortable as possible. Until the day before he passed, he would not allow me, his daughter, a nurse, to shower him. He would get up and go into the shower every day. He'd lock the bathroom door behind him so I couldn't come in to assist. And he was able to go out on his terms. And I define that as a good death. I miss him every day, but I'm so grateful that he was able to experience a good death. So remember that. We all want to live for as long as we can, but sometimes we have to decide at the end, do we want quality over quantity? I wish you all good luck in your future endeavors.